let's talk about post-needling protocol. What I've got with me is a Ziploc bag, glove, plenty of cotton buds, the sharp spin, the trusty sharp spin, which we must always have near us so that we don't have to extend and move too far away to pop the needles in, and of course the needles themselves ready to go in their guide tubes and out of their blister packs. What we have here is some needles placed into the peronei for perhaps some relief of pain in the lateral shin. Now I'm going to show you what to do as far as removing the needles. So let's remove the needles. We want to remove the needles nice and quickly. It's not a slow extraction. It's not like what you do to somebody who you want to hurt by ripping plaster off their back. No good. You could do this nice and quickly, and that's the best way to do it. So let's just do that. There we go. Pop that into the other hand, like so. There. Pop that into here, and so. Tap the needles like this. Pop them straight into there, and what we've got there is a small bleed into the skin here. And so, what we need to do now is pop the glove on, which you've had ready, of course. Pop that on here, and get my fingers in the glove, grab the cotton bud, dab the area, apply some pressure, 30 seconds or so. Then I pop the cotton bud into the Ziploc bag, and do that again on this spot here. Pop that into the Ziploc bag, close the Ziploc bag, and there we go, we've managed the bleed as well and shown you how to remove the needle. The last thing that I'll show you as far as post-needling protocol is this, a sweep of the area once you have finished needling. That's really important because you want to make sure there are no more needles in the area which you've been treating. You might think, well, you know, I can obviously see there are no more needles there, but when you're dealing with an area that's maybe a little hairy or it's a darker skin, the needles often blend into that skin and it's quite difficult to see the needles. So by moving across the area like so, you will drag the needles across the area that you're treating, and they'll pop out if they're there onto the pillow, and you can pick them up and get rid of them. But doing the swipe is really important just to make sure you don't send your patient off and with some needles in them.